My name is Cassandra Henderson. I'm just going to be doing a little education about chronic obstructive pulmonary disease. Uh, so what is chronic obstructive pulmonary disease, or COPD? It's a group of diseases. It typically includes chronic bronchitis and emphysema. Some patients only have chronic bronchitis, some only have emphysema, some kind of have a combination of both. But because they both more or less end up with the same symptoms, they're kind of grouped together. It's because there's a chronic obstruction of the airway. It's a non-reversible disease. It's characterized by progressive dyspnea, a chronic cough, and chronic tobacco use. And because the pathophysiology of chronic bronchitis and emphysema are just a little bit different, I'm going to discuss them separately. The pathophysiology of chronic bronchitis, its primary characteristics are mucus hypersecretion and loss of mucociliary clearance that causes obstruction. And you can see in the diagram here, it's a cyclical disorder. People kind of get trapped in this vicious cycle. In the normal respiratory tract, there is cilia. They're kind of hair-like structures that line all the airways, and they continuously sweep any kind of foreign bodies, mucus, anything up out of the respiratory tract and into the esophagus where those things are swallowed. With the airways clear, when you breathe in with inspiration, air is pulled into the alveoli and CO2 is expired. But when you have chronic bronchitis, the cilia along the respiratory tract are damaged, and it leads to the inability to clear those secretions. The mucus begins to build up, the airways narrow, and that can lead to increase in bacterial infections, and it can cause inflammation. When the airways are narrow, the inspiration still draws air into the alveoli, but the air becomes trapped in the alveoli because with expiration, it's a little bit more of a passive process, and it's just not as strong as inspiration. So the air becomes trapped. The alveoli start to stretch, and the stretching can lead to inflammation. Overall, inflammation in the airway is not a good thing. It's caused by a few things: by the alveoli stretching, by the increased mucus retention, and by the infection that tends to happen in the bronchioles. The inflammation leads to an increase in mucus production, and you can see it kind of keeps going around in a circle. The pathophysiology of emphysema, it's a little bit different. It's damage to the collagen and elastin fibers of the airways. So elastin fibers are destroyed and replaced with scar tissue. When the air is pulled into the alveoli during inspiration, it gets pulled in, but then those elastin fibers that are damaged are unable to open up the airways. And so that again leads to the retention of air in the alveoli. Basically, the damage caused by emphysema, it interferes with the structural integrity of the lungs, and its primary characteristics are lung fibrosis and loss of elastic recoil. There's quite a few signs and symptoms of COPD. You got breathlessness on exertion, chronic cough, chronic sputum production, wheezing, tachypnea, pursed lip breathing, use of accessory breathing muscles, dyspnea, and low SpO2 or low PaO2. For a diagnosis of COPD, the gold standard of testing is a pulmonary function test or spirometry. The pulmonary function test measures obstruction. It measures the volume of air that can be blown out and how quickly. Other testing is possible, such as a CAT scan, which can monitor emphysema progression, or a PET scan that can monitor pulmonary blood flow. They can kind of use it it's useful in detecting early COPD disease. Treatment options for COPD. Stop smoking, number one. Smoking is the number one cause of COPD. Other treatment options for Medicare, as far as medications go, most of them revolve around bronchodilation. You want to reduce that airflow obstruction, reduce the alveolar hyperventilation, and reduce that air trapping in the alveoli. You can see there's a bunch of different types of bronchodilators, and a lot of them there's some of them are combination, and there's certain ones, bronchodilators, they can use that are short acting for patients that have mild to moderate symptoms and some that are more long acting, and they can be used more for patients that have kind of moderate to severe symptoms and have frequent exacerbations. Pulmonary rehab is also a good option for these patients. It's where they can work with a team of specialists to help improve their physical condition and learn to manage their symptoms. The medication in the pulmonary rehab will not cure COPD, but they can help alleviate symptoms and improve the quality of life with patients. So, and then as far as number one cause of COPD, like I said, is smoking or exposure to tobacco smoke. Environmental issues can also cause COPD. If you've worked in a coal mine or other kind of occupational exposures to lots of dust, air pollution, and there's, according to Mitchell, there's also a very minor genetic link. And that is it for my presentation on chronic obstructive pulmonary disease.